prostate care has changed significantly over the years. And this morning we're joined by our good friend Dr. Greggory Pinto, and we're going to discuss how new advances are helping men access more personalized treatment options while maintaining their quality of life. Good morning, and welcome back to Bahamas and Sunrise.
It's always a pleasure to be here. Good morning, Bahamas, and I always have to say good morning to my daughter, Gia. So prostate cancer is the number one cancer killer in this country, even far exceeding the number of women, unfortunately, who succumb to breast cancer. At least 100 to 120 men every year die of prostate cancer, which die. And those are many men who are in the prime of their life. We're talking even some persons because of family history or genetics or predisposition who are dying in their 40s or early 50s. So one day they're the primary breadwinner and the next day they're gone. And usually the death is not a quick one. It's in and out of hospital, 5 years, 8 years, 10 years, a very slow, tragic death that is completely preventable.
Right, that's what I
So
was going to say.
of all cancers on this earth, prostate cancer is the only cancer that is 100%, well, nothing in medicine or science is a certainty, but let's say 99 point something percent certain that you can cure it once it's early disease, when it's organ confined disease. In fact, we can pick up prostate cancer so early now with so many different modalities that we can actively surveil many men for 8, 10, 12 years, sometimes for their lifetime, without even having to cure them. So our understanding of prostate cancer is growing by leaps and bounds. The technology is growing by leaps and bounds. And now we are trying to now transition to more focal therapy. So usually when you have prostate cancer, it's only in one part of the organ. So now treatment is geared at only treating that one part of the organ, killing only the prostate cancer, leaving the rest of the gland intact. We have so many genetic tests. It's almost what I'm going to say is like science fiction. Even FDA tests, not only for prostate cancer, for basically all cancers, where we can do a urine test, it's a fluid test, or a blood test, where we can determine in 5 years, your chance of getting prostate cancer is like 80%. In 8 years, your chance of getting prostate cancer is 90%. And that's just looking at fragments of DNA from cancer cells that are shed. And we're looking for those shed cancer cell DNA fragments, which can manifest long before even imaging, long before a blood test will pick it up. So we can, way in the distance, determine someone is going to likely get prostate cancer or almost certainly eventually get prostate cancer. We can diligently follow them, pick it up when it's very early, and then we can even, in many cases, just actively surveil. Prostate cancer is a very ingenious disease, and it's not what you call homogeneous. It's different for everybody. So some persons who have prostate cancer don't even need treatment. It's such an innocuous disease that we can just watch you because you're likely to die of old age before it becomes of any harm to you. But we can do DNA testing, genetic testing, chromosomal testing, determine who has that aggressive form of prostate cancer, who has more of the indolent disease, so we can stratify someone and say, all right, 70% of prostate cancers might be more slow growing, 30% might be very aggressive. So we can pick up who has the aggressive form. And we also do that. Yeah, we can also do testing in terms of genetics on persons who are already cured, and we can stratify them and determine, all right, in the next 20 years you have a 40% chance of recurrence versus a 0.5% recurrence. So we're going to treat those patients differently.
Treating the long game.
Yes.
All of this, all of the new advancements, the techniques, the technology, it sounds very exciting. Is that available here in the Bahamas?
So this world is actually a small place. So even if it's not available in the labs here, we send those tests off all the time. Even when many of these advances are not available widely in every state, sometimes I send blood results to a lab in California, but you get the results in a few days. So we have worldwide network where everything is available.
So earlier you mentioned, and you always say when you come on the show, that prostate cancer is a treatable and
100% curable.
Curable.
All we want to do is get an annual blood test, which is not a very specific test, called prostate-specific antigen. Inflammation, infection, incomplete bladder emptying, large normal prostate can cause it to be elevated. And what a lot of persons don't even really understand, even some physicians don't understand, is that you can have prostate cancer when you have a normal PSA. Even if you have an elevated PSA, it doesn't necessarily mean you have prostate cancer. That's just a gateway, easy test for us to get. And then we do more specific tests to determine whether we need to do imaging and the gold standard, which is readily available. And that's what we do in terms of our protocol for whether we need to biopsy and actually get a tissue diagnosis, is to do an MRI of the prostate. There are many MRI imaging centers here in the Bahamas that we can readily get the highest quality imaging to determine if you have a need for prostate biopsies. We can do targeted biopsies to make sure that we have an accurate diagnosis. And then we can also determine, even if because you have a high PSA blood test, it might be because of inflammation, like prostatitis. It might be because you're not emptying your bladder. All that we can determine. So studies have shown that as many as 70% of persons with elevated PSAs can avoid a biopsy if we do an MRI first. And we should do an MRI even before we do a biopsy anyway. That's protocol.
And so we can detect it early, we can cure it, we can figure out if we're going to get it in the future.
Yes.
So why are we dying?
Because men, particularly Bahamian men, are very stubborn. And it's a fear factor. They'd rather be ignorant of the fact that they may have prostate cancer. A lot of it is going back to their memory of seeing their grandfather die or their granduncle die, a horrible, terrible death from prostate cancer, and they have that in their mind. That's changed from long ago. My grandfather died from prostate cancer, but in those days, they didn't even have PSA blood testing. They didn't have the MRI imaging. They didn't have all these new advancements. So you can't look at what was in the 70s, the 80s, or even the early 90s to what we're doing now. It's completely transitioned, and we can save your life and let you live that extra 30 years.
Yeah, again, as speaking as a man, I think we have the superhero complex. There's the, all right, maybe we ignore it, it'll go away. I think specifically for the prostate exam, there was probably still fear around the dreaded finger test.
And I've said that innumerable times that there is no need for the dreaded digital rectal exam, because I even said we have blood tests that can tell you if you're going to get prostate cancer likely in the next 5, 8, 10 years.
Exactly.
We have imaging that's the greatest misunderstanding is that a digital rectal exam has any validity in terms of specificity or sensitivity, either to pick up prostate cancer or to rule it out. We're trying to pick up prostate cancer when it's early disease, when it's low volume, low stage. The digital rectal feels completely normal at that stage. So for your general practitioner to say, I did a digital rectal, don't worry about your PSA being elevated, even though your father got prostate cancer at 50, because I felt I did the digital rectal, you're getting a false sense of security, and you're getting information that can lead to your death.
Right.
So no, we do even more specific blood tests. We can do a phi test. We can do a PHI test. We can do PSA density calculation. A free PSA. We can calculate velocity of the PSA.
Options on options.
The options are innumerable. So looking at DNA testing, chromosomal testing, even when we do biopsies, we send off that pathology, that tissue, to do genetic testing on that, and we determine, is that an aggressive form of prostate cancer, or it's not aggressive form?
Dr. Pinto, we always learn so much when you come on the show with us. Reminding us men that we need to take care of our health, and if we don't, then we can lose out on a quality of life that we all deserve. So,
or you can die needlessly.
Or you can die needlessly, right? That's the other side of the coin. Thank you so much for being here. How do people find you if they want to get a checkup?
You can find me at Urology Care Bahamas Facebook, or urologycarebahamas.com, and my main office is at Oak Tree Medical Center.
Fantastic. Thanks again for being here.
I appreciate it.
Appreciate you. You're watching Bahamas at Sunrise. Go get yourself checked out. Go get your PSA. Go get all your tests done. There's no reason for us men to die from prostate cancer. We'll be right back.